Hi, everyone. Welcome to the Nourish from the Start, ensuring prenatal-to-three families have the food they need to thrive. Thank you for joining us today. We know that you could be doing several things today, but this is going to be a great webinar. So a few housekeeping rules. This meeting will be recorded and available slides and resources will be shared within a week. We have a very large group, so please mute your microphones when you're not speaking. You need tech support? Connect with tech support through chat. Also, we would prefer if you raise your hand or enter questions in the chat. They will be addressed during the webinar. Closed captioning is available through Zoom. And the National Collaborative for Infants and Toddlers is happy to provide translation services. Let us know when registering for this and upcoming events. And so with that, our presenters today will be Katie Bishop-Kendricks. She's the National Senior Advocacy Consultant with Voices for Healthy Kids. Clarissa Hayes, she's the Deputy Director, Child Nutrition Programs and Policy from FRAC. Ed Bolin, Director of SNAP State Strategies from the Center on Budget and Policy Priorities. Elizabeth Epps, Senior Program Manager, Center on Budget and Policy Priorities. And Jessica Pino-Goodspeed, Deputy Director of Public Affairs, Hunger Solution, New York. I am Danielle Patterson with the National Collaborative for Infants and Toddlers and Voices for Healthy Kids. I will serve as your moderator today. And with that, I am going to turn the program over to Katie Bishop-Kendrick. Katie?
Great, thank you, Danielle. Hi, everyone. I'm really excited to be talking with you about Nourish from the Start, and you can go to the next slide. Back in May of last year, the Pritzker Children's Initiative initially brought together a group of folks to talk about what is needed to ensure that pregnant folks, infants, and toddlers have the food that they need to thrive. That group turned into the Nourish from the Start planning team, which included FRAC, the Food Research and Action Center, the Center on Budget and Policy Priorities, Feeding America, and the Voices for Healthy Kids initiative at the American Heart Association. I'm going to turn it over to Clarissa Hayes from FRAC to talk about why we were specifically focused on the PN3 population.
Amazing. Thank you, Katie. And hi, everyone. It's great to be here with you today. We are so excited to be part of this project. So like Katie said, I am going to talk later on about CACFP, but I'm going to quickly touch on why the earliest years of life, specifically prenatal through age 3, are such a critical window for nutrition and why it's the focus of this project. So the science is thankfully very clear. Prenatal and early childhood nutrition are key drivers of brain development, lifelong learning capacity, and both physical and mental health. So 0 to 3 is one of the most critical years of development, and ensuring access to healthy, affordable food is a really important part of that. And building on that, the other thing that research shows is that participation in the federal food assistance programs has a lasting positive effect on children's development. So specifically SNAP, WIC, and CACFP, they are playing a vital role in supporting PN-to-3 families, but we also know that they can be underutilized in some communities. So there are definitely opportunities in every state and on the federal level to strengthen and improve these programs, and also in a coordinated and cross-sector approach. So that is what this project aims to do. Katie, back to you.
Thanks, Clarissa. So on the next slide. So as the planning team, we created the Nourish from the Start policy agenda, practical, actionable solutions to ensure that every prenatal-to-3 family has stable access to healthy, affordable foods. The policy agenda includes short-term, meet-the-moment practical recommendations to be accomplished in the next 1 to 3 years, as well as longer-term, more visionary recommendations or ones that need more ground softening to be accomplished in the next 4 to 7 or more years. As a group, we talked about many different things that contribute to a family's ability to get the food that they need. Things like having a high enough wage, stable, affordable housing, access to paid family and medical leave, and many other things. But for this agenda, and for some of the reasons that Clarissa just mentioned, we decided to primarily focus on three of the federal food assistance programs that are really the backbone of food assistance for PN3 families in the US. So we focused on SNAP, the Supplemental Nutrition Assistance Program, because it is the largest food assistance program in the US. And then also the WIC program, Women, Infants, and Children, and the CACFP program, Child and Adult Care Food Program, because those programs specifically target on segments of the PN3 population. On the next slide. So for each of those programs, we have recommendations under these three themes. So ensure access to food assistance programs for PN3 families, modernize and strengthen food assistance programs, expand availability of nutritious, culturally preferred foods for families with young children. And there are some recommendations that sit outside of the three nutrition assistance programs that I mentioned, but really the majority of the paper is focused on those three programs. There are a couple in there around breastfeeding and a couple that touch on some of the other food assistance programs, but the majority is on SNAP, WIC, and CACFP. So now I'm going to turn it over to some other members from the planning team to talk about what's currently happening related to those programs, and then also give an overview of some of the recommendations for those programs. So I'll start by turning it over to Ed Bolin from the Center on Budget and Policy Priorities.
Thanks so much, Katie, and thank you all for joining today. It's an honor to be able to share a few words about SNAP. My name's Ed Bolin. I'm with the Center on Budget and Policy Priorities. We focus on SNAP both at the federal and state level. So I will give you a quick snapshot of what's going on with SNAP and what we can do about it through this initiative. SNAP is the Supplemental Nutrition Assistance Program, formerly called and sometimes still called food stamps. Most states have renamed it to something in their state, so lots of different names for it, but it's basically a benefit that households get on a card that they can go to the grocery store and use to purchase the foods that they need for their families to thrive. Folks get about $6 a day on average. It will vary depending on people's circumstances. It's targeted for more benefits to lower income families because they need more help putting food on the table. And it serves nearly 40 million people. So it is our nation's primary nutrition assistance safety net. All sorts of folks under many different circumstances, if their income is low enough to need help putting food on the table, may be eligible for SNAP. So it has a broad reach. About 40% of that 40 million folks are children. So it's actually an enormous and important child nutrition program. About 60% of all people on SNAP are in households with kids. So it really is a program that helps families, especially young families, get some of the supports they need to thrive. Next slide, please. So what's going on with SNAP? I think the story is an unfortunate one right now. Since about July of last year, when HR 1, or the One Big Beautiful Bill, was passed into law, more than 3.5 million people have lost SNAP. We used to say 42 million folks participated. Now it's under 40 million. That's a 9% decline. It's a historic decline. We've never seen, especially with these larger economic circumstances, this kind of a drop in SNAP participation. So it's quite troubling. We'd often say, okay, why is SNAP declining? It's great if people have more income, if they're doing better and they don't need the program, then they leave the program. That's a wonderful thing. That doesn't seem to be the case. SNAP typically tracks unemployment quite closely because it's so responsive to households' economic circumstances. Somebody loses a job, that's the primary reason they turn to SNAP. Somebody gets a job, it's a primary reason they leave SNAP. But that's not happening. Unemployment has not dropped significantly, and economic circumstances haven't improved for folks. In fact, with inflation and high food costs, it's getting harder and harder for people to put food on the table. The evidence kind of shows that it's most likely because of changes in that HR1, that bill that states are trying to grapple with, that's caused the decline. Every single state has seen a decline. Georgia looks on this map here like maybe it's okay, but that's just because their data is a little screwed up. They've actually seen a drop in participation as well. Some states have seen significant drops. Arizona, more than half of the folks that were participating in SNAP a year ago are no longer on the program. Let's just for time purposes go to the next slide because I have one more piece of bad news to share, which is the declines do not shield children. We only have data from about 12 states that publicly put out more detailed information about who's participating in SNAP. So we know the number of children participating or losing SNAP. And so for those 12, all 12 states have seen a pretty significant decline in children. Again, some of them are quite severe. Arizona leading the charge with over half of all children no longer participating in SNAP. But what we can conclude from this, I think, is that it's likely that in most states, there's a lot of children and their families losing access to this important program. Let's go to the next slide. I said that we think it's due to changes due to HR1, and that's partly because HR1 made really significant changes to SNAP. It did change eligibility for some people, but not for kids directly, at least for most kids, and young kids in particular weren't really directly affected. But it did require states to pay for a portion of SNAP benefits if they couldn't keep their error rate down low enough. That all hasn't happened yet. But I think every single state, when they saw this law come into effect, said, oh boy, I better check my error rate, see how I'm doing, and make sure it's as low as possible. And because we don't want to have to pay for a portion of SNAP benefits, the program is just too big for our state budgets to accommodate. And so you can see here, I'm doing a very, very quick job of outlining kind of the state of play, because it really dictates what we can do in our communities to protect folks and ensure access to SNAP. But you can see that almost every state in any kind of a shaded blue on that map is facing a potential huge state budget hit when this cost shift, as we call it, goes into effect in SNAP. That will happen in 2028. That's coming very, very fast in the world of state budgeting. And some of those shifts can be quite significant, hundreds of millions of dollars in new state funding in order to keep SNAP the way it has operated in the past. If you add up all the different states that using out-of-date information, but the most recent information we have, the amount of funds that states would have to come up with would approach $7.5 billion. So just think of that at a state level and how likely your state could do that. So that's most of the bad news. So what are states doing about it? If you can go to the next slide. We really kind of think of the HR1 legislation as setting states up to fail. They have to come up with the funds for this cost shift, or they have to cut revenues, cut programs elsewhere in their budget to pay for the cost shift. They could shrink the size of their program so that there's less folks on SNAP and hence less of a share that they have to pay, or they could actually opt out of the program entirely. It's a state option to participate in SNAP, and so far every state has always done that. But given that this fiscal pressure, that's a little bit up in the air, and we've heard state lawmakers and state policymakers make some concerning remarks about their ability to keep the program if they have a significant cost share. There's some other changes I'll skip over for the purposes of time, but what that really means is that states are obsessed with getting their payment error rates down low. The lower it is, the less they would have to pay for a portion of the SNAP benefits. And if it's actually below 6%, they pay nothing. So every state is saying, what can we do to get our payment error rates down? And there's lots of things they can do. Unfortunately, not all of them are good, and not all of them help individuals and families who need access to the program. One thing they can do is add a lot of bureaucracy and red tape and excessive reporting in order to collect a lot of information with the hopes that that would allow them to get an accurate payment rather than a payment error. Again, that's the world that we're sort of living in SNAP. And if we'd done this presentation a year ago, it would have been completely different because we've never faced this kind of in some ways, existential threat to the program, and one that's driving so strongly what states are doing in the program itself. So just a couple of ideas. of what states are thinking of and where community advocates can have a real impact. If you go to the next slide, these are all, I'm not going to read through the small type, but this is all from the report, Nourish from the Start, outlining in those three buckets that Katie mentioned, the different approaches that communities and states can take in addressing SNAP. One of those themes was sort of ensuring access to SNAP. And I think the actual specific things that advocates can do with their state SNAP agency, with media coverage of these cuts, with actual information for participants is at the federal level, try to push to reverse some of these changes. And there's really efforts underway to at least allay the impact so states have more time to prepare. And at the state, where the real action is, there's lots of opportunities to educate lawmakers about what they should be concerned about and to help state agencies make decisions that don't impact in a negative way people's ability to get on or stay on SNAP. Families with young kids are especially vulnerable because they're the kinds of households, especially if they're working, that might be at risk, or the state might think they're at risk to be a payment error, like the benefit amount could be wrong. So it's really imperative to have advocates making sure states are making wise decisions there. Next slide. I think I'm almost at my time limit. So I'll just, again, quickly touch on these. Modernizing and strengthening SNAP is something that the program desperately needs even before HR went into effect. There are some pretty archaic computer systems that are determining these eligibilities and payment levels. Those are sometimes the source of these errors. It's not necessarily like a household's problem. It's often a state agency problem. So there's lots of opportunities to help states modernize, streamline, and strengthen SNAP. Just to flag a few, the eligibility process could be improved. Interviews could be made a lot easier for folks to get through. Call centers, some attempts at modernization are things like call centers and uploading documents, and those sometimes work and they sometimes don't work. And so state advocates and community partners, especially those that can see on the ground what those impacts are, have a real value in helping their state understand how these changes and these attempts to bring down their error rates are impacting actual people who need help putting food on the table. Last slide, I think. And then expanding nutritious, culturally preferred foods is another one of the sort of themes. And again, there's a lot to do here to help make sure that folks have access to the foods that they actually can use and prefer to feed their families with. And again, there's options to think at the federal level of modernizing the way that benefits come. SNAP food stamps used to be paper stamps. Now it's on a card that looks a bit like a debit card. It's not protected the same way as debit cards are. So there's vulnerabilities that households deal with. There's also lots of opportunities to bring in maybe innovative ways of delivering benefits or providing resources and places to buy benefits, like farmers markets and places that can offer culturally appropriate foods. So it was a bit of a whirlwind, but I think the context that we're in now really raises the importance to get involved in our states to make sure that our states are making wise decisions about how they deal with this new federal landscape they're in. And I think all of us and all of you in your communities are actually like the eyes and ears who can see what's happening, people losing benefits, people not being able to recertify for eligibility. And that is actually information that state agencies desperately need. So I think there's a real opportunity for you to bring important information and expertise on the sort of ground to state agencies as they work on this. So that's the whirlwind, lots of details behind all of that. And I look forward to working with some of you to see what we can do in our states. Thanks. Oh, and I'm supposed to pass it over to my colleague, Elizabeth.
Thanks, Ed. And thanks, Danielle and Katie and the whole Voices team for welcoming us to share today about some of these anti-hunger programs. Ed, I think, set a good foundation for what I'll be talking about in terms of WIC. So my name is Elizabeth. I am also on the food assistance team here at the Center on Budget. And I'm going to briefly touch on kind of our current national landscape for WIC, and then some of the recommendations that came out of the Nourish from the Start initiative. So next slide, please. So I want to touch on three things in terms of our current WIC landscape. And this is definitely kind of an abridged version of everything I could touch on. But the first thing is, and when I say WIC, I'm presuming that people in this audience know what I'm talking about, but just to briefly say the Special Supplemental Nutrition for Women, Infants, and Children. This is a national nutrition program for parents and young children, and it's a specific package of healthy foods along with nutrition education, breastfeeding support, and referrals. So that is WIC. And WIC has a really great thing called the cash value benefit for fruits and vegetables, which is a set amount of money each month that each participant can use to buy all sorts of different fruits and vegetables. And currently, the value of the cash value benefit is under threat from the administration and members of Congress. So that's one thing I wanted to touch on. The second thing is virtual services in WIC, which have really expanded since the beginning of COVID and the lockdowns. The waivers that WIC agencies are using to be able to adopt virtual services are set to expire in September of this year without congressional action. So we're really watching that right now as an important policy decision that Congress has. And then the last thing is caseloads. So I have three different graphics here on this slide with regard to caseloads. So the one on the far left is, and these are charts that are pulled directly from USDA's website, but this is looking at participation from fiscal year 2010 all the way through 2025. And you can see that from a high of over 9 million participants right after the economic recession of 2008, 2009, we had, just over 9 million participants. And then throughout the 2010s, we really saw a steady decline in WIC participation to where we hit a low in about 2020 of just over 6 million participants. So a pretty dramatic decline over a long period of time. And there were a lot of factors involved in why we saw participation declines. And I'm not going to get into all of those in today's presentation, but I wanted to remark that in the last few years since 2020, we've started to see promising trends of participation starting to go up again. And as of 2025, we're back up close to just under 7 million participants nationally. So positive trends as far as caseloads. Now, the middle graphic on this slide is looking at a different metric, which is coverage. In WIC, that term means the number of people who are participating of the people who are eligible. So the coverage rate has fluctuated in recent years, but was between, I would say, 2000, looks like 2019 to 2021, it was down around just over 50% of eligible people who are participating. And we are happy to report that between 2021 to 2023, we've again seen a positive trend in coverage rate. So we're up around, as of 2023, which is the latest data we have from USDA, we're up around 56%. And this particular chart is from a coverage report published by the Center on Budget and Policy Priorities. So we are trending in the right direction with WIC coverage, but 56% indicates that we still have a long way to go to truly reach all of the people who are eligible for WIC. And so I'm going to get into this a little bit later, but WIC has been modernizing a lot in recent years. but still has a ways to go to be a truly modern program. And I'm going to be highlighting some of the ways that WIC agencies are striving to best meet the needs of participants and really continue to boost that coverage rate. So finally, just very briefly, on the far right of the slide, I do want to remark that we're starting to see a leveling off and a decrease in participation just in very recent months. And this is preliminary data from USDA. So as you can see, in 2020, in fiscal year 2026, we've gone from about 6.9 million participants in October down to just over 6.6 million in February. And we don't have solid research on what is causing these recent declines, but we hypothesize that some of the things that Ed was talking about in terms of the HR1 impacts on SNAP, as well as impacts on Medicaid, are having peripheral impacts on WIC, because one of the primary ways that people are able to enroll in WIC is through being adjunctively eligible in SNAP and Medicaid. And so if we're seeing these downward trends in eligibility and in participation in some of these other big programs, that is going to have ripple effects on programs like WIC. So that's one of the things we're looking at, along with, I would say, fears among immigrant families to participate in any government program right now. So we're looking at a couple of different factors, along with the government shutdown that happened in November of 2025. So those are some more recent caseload trends. But next slide, please. So just a couple things about the cash value benefit for fruits and vegetables. This was first increased in 2021, and the increase was based on recommendations from the National Academies of Sciences Expert Committee. And so the dramatic increase in the cash value benefit has been extremely welcome and extremely well received among WIC participants. This has made the WIC food packages just a lot more attractive and has helped families purchase more fruits and vegetables and be able to better feed their children while participating in the WIC program. So just to quickly note, the President's fiscal year 2027 budget is calling for the cash value benefit to be slashed to back down to where it was back before 2021. And the House bill that the House Appropriations, Agriculture Appropriations Bill, which was released recently, has a smaller cut to the cash value benefit, but the subcommittee chair has said that he's committing to resetting the cash value benefit to those earlier levels. So we're currently urging appropriators to maintain the enhanced value of the cash value benefit, similar to what they did last year. So we're going to be continuing to push on that. Next slide, please. And also just a little more on virtual services. So similar to the cash value benefit increase in WIC, the availability of virtual services, specifically virtual certification or enrollment appointments in WIC, has made such a difference to WIC participants for the last 6 years since it's been available. And so states have been able to use waivers from USDA to be able to offer these virtual appointments. However, the waivers are set to expire September 30th of this year. We have heard from USDA that there are signals that that expiration, that it is likely that there will be an extension of that authority for agencies to continue to provide remote services. However, what we are really pushing for is for virtual services to be made permanent in WIC so that WIC agencies can really plan for being able to offer virtual services in the long term. And we are expecting the Senate Committee on Appropriations is going to be marking up their agriculture bill in 2 days, so this Thursday. And so we are really, we've been pushing appropriators very hard to make sure that this permanent virtual services provision is in that appropriations bill, so that WIC agencies can continue to offer these services. Next slide, please. Okay, so I know I'm probably coming to the end of my time as well. So just to touch on some of the recommendations that we have both for the federal government and for states. So in the short term, our biggest recommendation for WIC, because WIC is subject to the appropriations process every year, it is a discretionary, not a mandatory program, is for Congress to fully fund WIC, including providing full food benefits to all eligible applicants. So that's kind of our biggest recommendation. And again, making those remote service flexibilities permanent, finalizing the rule to facilitate online shopping for WIC foods, and continuing to base WIC food packages on strong nutrition and science. In the long term, we are urging Congress to transition WIC to a mandatory program, meaning it will not be subject to the appropriations process each year, increasing the value of the fruit and vegetable benefit beyond its current value, and we're encouraging Congress and federal policymakers to evaluate transportation barriers and provide recommendations for states to reduce barriers. Next slide. And then finally, recommendations for states. We are encouraging states to restrict efforts to restrict WIC eligibility, including restricting eligibility for certain immigrant populations. We are encouraging states to strengthen the WIC Farmers Market Nutrition Program and encouraging state WIC agencies to use strategies to increase WIC participation. So going back to my original slide on the coverage rates in WIC, some ways that WIC agencies can improve those coverage rates are things like outreach and referrals, including developing referral mechanisms for healthcare and social service providers, and partnering with community-based organizations. Another way that states can enhance WIC participation is to streamline enrollment processes and ensure that food packages reflect participants' cultures and dietary preferences. I think that is all that I wanted to cover, so I'll pause there and hand it to Clarissa, I think.
Yes, thanks, Elizabeth. All right, we are going to end with CACFP. So if you have never heard of this program before, it provides reimbursement to offset the cost of meals served at childcare centers, family childcare homes, and after-school programs. There's also an adult component to this program, but today's focus is obviously on children 3 and under. And just for some background on participation, in fiscal year 24, there are about 4.4 million children who were receiving a meal through this program on an average day. So on the next slide, I won't spend too much time on this because I only have 10 minutes, but I just wanted to quickly touch on the many benefits of this program. And this slide here just shows a summary of some of the research that is out there on CACFP. So we know that there are many health benefits. For many children, the meals served at their childcare center or home that are served through CACFP are going to be some of the most balanced and nutritious food that they eat all day. We also know that there is an economic value here. So obviously having kids in care to work, and that makes childcare more affordable. It also is supporting jobs directly in the childcare sector. And then for the most part, meals that are served at the centers and homes, folks are buying the food at local grocery stores. So it also has that economic support. And then I think the thing that is often overlooked with CACFP is that it's also just a quality indicator of childcare. So it's boosting childcare providers' income, it's supporting that workforce, and just strengthening overall quality early child care. All right, next slide. So despite all these benefits, I would say CACFP definitely remains underutilized. As you can see here on this chart, participation in CACFP childcare centers, which is that orange part of the graph, that has held pretty steady. We did see a dip right after the pandemic, but you can also see participation by family childcare homes in CACFP has drastically decreased since 1997. And that is when there was a change to the way that those programs are reimbursed and a tiered reimbursement was introduced. And that's important because we'll talk about it in a little bit. So unlike SNAP and WIC, there are no current attacks or attempts to roll back participation in CACFP, which is great. I will also say that there has not been any huge improvements or changes to the program in a positive way in many years either. There are many childcare programs that could participate and are eligible and don't. And then I would also just say that with the SNAP cuts that Ed mentioned, we know that the other programs like CACFP and school meals and summer meals, after school meals, all those programs are going to become even more important as families lose those benefits. So with all that said, what are some of the reasons that programs aren't participating? We know that the administrative burden and the paperwork for this program is top of the list, top biggest obstacle to why programs are not participating. And that's especially true for some of those smaller family childcare homes that I mentioned. We also know that low reimbursement rates are another major concern. We hear all the time that the reimbursement rate is not keeping pace at all with the cost of purchasing food and preparing nutritious meals. And a lot of these programs that are participating in CACFP, it's not covering the whole cost of that. And that's especially given recent food price inflation in recent years. And then the last bigger bucket here is just a lack of awareness about the program and a lack of training and technical assistance. Like I mentioned earlier, a lot of providers are eligible to do this program, but they may not be aware of CACFP. They may not know how to get started or what's needed to participate. So more training and outreach is definitely necessary. And I would say there have been many identified solutions to fixing the issues with CACFP on both the federal and state level. And thankfully, those align with the pieces here in the agenda that I'm going to touch on in the next couple of slides. So the first slide here that I'll touch on with recommendations mirrors SNAP and WIC around ensuring access. So at the federal level, like I mentioned earlier, we really need to increase the reimbursement levels to attract more providers and operators to this program. We also need to eliminate on the federal level that tiering model that I mentioned earlier. That is where in 1997 you see a very steep decline in participation. That is when that tiered model was introduced, and it's really discouraging family child care homes from participating. At the state level, we are encouraging states to offer robust technical assistance to prospective sponsors, providers, and sites. And states should also be proactive in the outreach to childcare providers. So again, just letting them know about this program and helping them understand the benefits of participation, especially if these centers and homes are providing meals out of pocket. They could do CACFP to help offset the cost of those meals. We're also encouraging states to provide, where they can, supplemental funding to fill the gap between that federal reimbursement and the actual meal costs. And the last point here is around supporting and adopting healthy childcare meals for all initiatives. So on the school meals front, we've seen a lot of momentum behind universal school meals. We have 9 states that are currently doing that. The aim is to also have that happen on the childcare side of things so that any child in a home or center is getting a meal regardless of their family's income. All right, so on the next slide, I'm going to cover opportunities to modernize and strengthen CACFP. So at the federal level, we have a recommendation to update the serious deficiency framework. And this is kind of in the weeds here, but basically inside CACFP, this is the process for handling any compliance issues within CACFP. It has not been updated for many, many years, and there are flaws to the system. So updating that with a lens more of technical assistance could get more providers and programs into CACFP. We also want to advocate for allowing a third meal for long hours of care. Many children are spending 10 or more hours in childcare, and right now CACFP is only reimbursing 2 meals and 1 snack. So we strongly believe that that third meal option is going to better reflect the reality of working families. Talking more about reimbursement, so going back to a single predictable reimbursement rate for centers. Right now, the current rate structure is a little complex and can vary depending on multiple factors. So that can also add to some of that administrative burden that we talked about earlier. And then on the state level, USDA in recent years has released opportunities for states to streamline their paperwork and reduce paperwork. And we're really encouraging the states to take that up and streamline some of those administrative requirements. Next slide, please. So I believe my last slide here is on expanding the availability of nutritious and culturally preferred foods. So at the federal level, we want to make sure that we're maintaining strong nutrition standards for meals and snacks. We did have changes to CACFP in 2015, and that was a major step forward. So we want to make sure that that is not rolled back and that we build on that progress. We also really need to support providers in preparing the meals, which would involve increasing funding for training and kitchen equipment so that they have the infrastructure to prepare these meals and participate in CACFP. And then on the state level, looking at training and technical assistance to help these operators meet the nutrition standards, and just really being aware that every community is different and that the meals being served hopefully reflect the families that are being served. And then the last piece here is around supporting farm to early care and education. You may be familiar with farm to school, and there has been a lot of momentum around farm to early care and education and just getting some of those local fresh foods into childcare settings and having that be part of the learning experience. So putting more support behind that on the state level could be a game changer here. So that is what I have on CACFP. I think I got through that on time, and I will turn it over to the next person.
Thank you so much, Clarissa. We really do want to thank our speakers, Katie, Clarissa, Elizabeth, and Ed for presenting this information on SNAP, WIC, and CACFP. Next slide. Oh, so now we want to transition to an interview with Hunger Solutions New York. Jessica Pino-Godspeed. She's the Deputy Director of Public Affairs for Hunger Solutions New York. Jessica, would you introduce yourself and provide an overview of the work Hunger Solutions New York does on CACFP, WIC, and SNAP?
Absolutely. Thanks so much for having me. It's great to follow up from such great speakers and close partners that we work on throughout the years on all these programs. But I'm from Hunger Solutions New York. We are a statewide anti-hunger organization where our focus is really to expand access to and participation in the federal nutrition assistance programs. We work across all of those programs, including SNAP, WIC, and all the suite of child nutrition programs, including CACFP, summer meals, school meals, and summer EBT. A lot of our work is done through partnerships, through advocacy, through outreach, through education, probably things that many folks on this call are very familiar with and work closely doing. We do a lot of key part of our work is advocacy, and I'd love to take a little time to talk more about that with you. And really our work in advocacy, we're leading and supporting policy campaigns that prioritize access to SNAP, WIC, especially at the state level, and also CACFP. We really work in conjunction with our national partners to be pushing on that federal side, but also how can we be working with our state agencies and our state partners to expand access?
Jessica, what policy or advocacy work has been most effective in your state for improving access to these three programs?
So across all three programs, I think I want to focus, I think, a little bit on SNAP. I think the recommendations and the breadth and depth of the what has come out of this work is really all encompassing in a lot of the different things that we do. So I want to just focus on SNAP for a minute and bring it back to WIC and CACFP from there. But a lot of our work in New York, we have funding for SNAP outreach. It's a network of SNAP outreach navigators that help folks apply for the program, help with recertification. They also help with awareness for SNAP. And this is a program that's been available in New York for about 40 years. New York Hunger Solutions New York, we're fortunate to be able to be the contractor on that SNAP Outreach Navigators program. And most recently in this past year to year, we work to secure funding to make sure that that funding is available in communities. These are folks who are ears and eyes on the ground, helping families get access to SNAP, help identify barriers to program participation, where are folks getting hung up at their local Department of Social Services. And we work with those on the ground navigators to then bring solutions to state agencies about what they can do to facilitate better participation, to deal with maybe unnecessary paperwork barriers or certain parts of the state that may have less internet access. So really key things that are getting in the way, especially for families with children to access SNAP. The effort this year has transformed a little bit because of HR 1 and the cuts that have happened in state administrative costs. Part of that state administrative cost cuts included federal dollars for SNAP outreach. So we had a tough battle this year in terms of our SNAP Outreach Navigator funding. And we know what a critical piece it is for SNAP access. At the same time, we're dealing with what Ed was really outlining around SNAP, the restructuring of new SNAP rules, new work requirements. And our SNAP navigators are really the ones on the ground helping families navigate through that, being an intermediary with our state, with our local county Department of Social Services that enroll families, and really kind of making sure also in terms of error rates, making sure that those applications have all the pieces they need, helping Department of Social Services see maybe where they've missed things as well. So really kind of being a great facilitator to not only help families get through the door for SNAP, but also help the state lower error rates, lower administrative mistakes that could happen, whether that's unintentionally from a family or unintentionally from a Department of Social Services. So we really focused in on this SNAP, these SNAP navigators, firsthand seeing this cut from the federal funding being lost. It was about a $5 million loss in terms of our program. We were able to articulate that to our state elected officials about what this meant in New York. We really made an intentional strategy to talk about HR 1 cuts as an opportunity to show what was coming most immediately for families and what's going to come down the pike as these HR 1 cuts continue to roll out. So happy to report that we had a victory as recent as this past week. Our state budget finally has gone through. That included that additional funding to fill that back gap in funding for SNAP outreach. It really gave us this really important opportunity to approach lawmakers and help them understand the connections of all these federal programs and how they play from one to another. And really started the conversation, because this is just the start of where we need to be pushing on our state and showing our state agencies that we're an ally and that we're working to overcome the hurdles that is really coming down the pike from these federal decisions that have been made around these programs. So, really kind of thinking about these different principles and these different recommendations and how that really plays into our work. It's really critical too that being able to help folks see this connection to HR 1, see the impacts of what happens when SNAP, our largest child nutrition safety net program, is being attacked and that foundation is being chipped away. What does that then mean for our CACFP providers and also on the WIC side? So these are also other state level budget priorities that we have. And on the WIC side, we are working to secure more funding for WIC agencies. We're in a different predicament in New York. We've had a statewide outreach contract for WIC over the last 5 years. We've seen growth in the program. And especially as families fall off of WIC, especially immigrant families, we want to make sure that WIC is available for folks. But the perfect storm is happening where there's gaps in terms of that funding for WIC agencies to make sure to keep up with the pace of demand. We've seen a 25% growth in our WIC participation in New York. So we're fighting hard for those budget gaps to make sure WIC agencies have the resources they need to ensure access to WIC. We're helping lawmakers understand why that's so important in relation to when the storm of SNAP is happening and the attacks on SNAP are happening. And then also to be able to talk about CACFP investments. We know that when children fall off of CACFP, it threatens the ability for providers to operate CACFP, the amount of funding that they're getting as well. So being able to really clearly connect the dots early and often to our lawmakers and those who are making decisions on state appropriations and what to prioritize. We're working hard as a coalition with other folks from anti-hunger spaces, from healthcare, from childcare to help them see the importance and really the critical time that it is to be making investments in our state's food access infrastructure.
Well, you're doing some really great work in New York. And we know that this work is not done in a silo, right? So what advice do you have for partners that want to connect more with prenatal-to-three families to the federal nutrition programs?
That's a great question. And I think too, if you're working on other programs, if you maybe you're new to the prenatal-to-three community, or if maybe you have expertise in other parts, we've really been able to learn from how we've done our partnerships well in school meals, how we've done our partnerships well in other areas. We're partnering closely with our food banks, for example. I would say I think my most trusted advice through the years has been partnerships are really the key. To have trusted messengers out talking to families, especially at a time where confusion. Many families are scared about, what these changes mean for them and their families. They're wanting to do the right thing, but also navigating a really such a time of transition at this stage in life. And so the more that you can partner with the folks who are already touching the different aspects of these families' lives, the better positioned you are to get good information out to families, to get clear information out to families as well. I think we're seeing our state agencies really do the best they can, but really grappling with lack of guidance from the federal government to be able to give clear guidance, being able to be a partner in that sense, and get the word out to families about what to expect with these applications and what the rules are, is really key. I've had a lot of success just being an easy, reliable partner to help folks with their questions navigate, maybe some of the barriers or concerns that, the folks that they're serving are facing. We really try to have turnkey resources, being able to provide folks even with simple things such as social media posts and network newsletters and different articles for the different communications that they're sending out to families that they can then flip and put into their own voice. We have a big saying of not reinventing the wheel, making sure that folks see these programs and promoting them and having some ownership over them as well. And so when we find it even more powerful when it's our Head Start that's out communicating about SNAP and about WIC. And it's also when our childcare providers, these are folks that families are really kind of going to for trusted information. I have some resources I could definitely share from our advocacy from this last year, such as we have budget advocacy sign-on letter, a lot of these trusted messengers in the outreach space have then been able to also support us in our advocacy, and really sometimes unusual partners from the religious community to just different folks who are working across different services for these types of families. So happy to share too, in terms of like who we're working with in other states. We've learned a lot from other states and seeing their coalitions, seeing their sign-on letters of who could I be partnering with that I'm missing. And I think too, helping alongside partnering with folks is don't discount the opportunity to provide some education. Well, a lot of us are in the weeds of what's really happening on the ground with these programs, what's happening federally at the state level. What can we do to make it easy for folks to understand? So we also have some examples too of fact sheets. One fact sheet that we created that was particularly helpful and really has brought a lot of our groups together is something that outlines what each HR1 cut does in New York State, what that impact is, and a recommendation for the state to what they can do to be addressing that in the state budget. So in the spirit of not reinventing the wheels, happy to share that with folks if it's helpful. But I think that would be my high level feedback for folks looking to get into this work.
Wonderful. Thank you so much, Jennifer, for sharing the work from your organization, from Hunger Solutions New York. We want to get in a few questions before we end the webinar. And so right now I'll transition to questions and answers to see if we have anyone that have any questions. Feel free to raise your hand, come off mute, and we will take a look at the questions that may be in the chat. 1 second. I'm working with 2 screens and I've lost the question. Hold on 1 second. Okay. Are there any questions in the chat, or would anyone like to come off mute? Feel free to raise your hand. The other thing I would like to mention is we do have a brief survey up on the screen. Please feel free to fill out the survey. It's really quick. One question that we do have, are there any family child care educators, providers, a part of the community? We care for the age group. We need to be part of the conversation. I'm thinking that that's directed to you, Jennifer. Jessica, I'm so sorry, Jessica.
So specifically in New York, or I wasn't sure if that was for this group convened today or our work here in New York.
I'm thinking it's probably general, like do you have any family child care educators, providers, part of the community? And I guess this would be good information for other groups to add them into the conversation as well.
Absolutely. So we often work with the networks and organizations that work across statewide. As a statewide organization, we're looking to plug into those networks. We have, in terms of family child care, we have our Early Care and Learning Center or Learning Council in New York State. You might have something similar in terms of an organization that coalesces family child care and providers, both centers and homes. And then we also have some statewide organizations of just home providers in New York. It's, oh my goodness, we talk in acronyms all the time, but it's an association of early education providers. So I think in terms of to make this applicable to like across different states, if you have even unions that are working to the union for us is CSCA for home care providers, we often tap into those statewide groups that bring together childcare providers and try to meet them where they're at, whether they have statewide conferences or statewide convening, so that way we can be not necessarily creating more work for those folks who are already kind of busy and grappling with a lot of things, but maybe attending where they're getting continuing education or where they're able to convene with other colleagues.
Thank you.
So
Thank you
that
so
might be
much.
helpful.
Thank you so much, Jessica. We are at time. We certainly appreciate your attendance today. We really thank our speakers, for Katie, for Jessica, Elizabeth, Clarissa, and Ed for the information. Again, all of the slides, the presenters' information will be shared shortly after this webinar. And if you have any questions, we will have a contact person in the email as well that you could reach out to with future questions for the Nourish from the Start program. Again, thank you so much for attending this webinar. We hope that you have a wonderful rest of your day.